Get started. Okay, well, welcome everyone. Thank you so much for hopping on our first Ask the Doc with Dr. Dick Walker. Really excited to have you all on here with us. As you are hopping on, if you can just keep your lines muted so that we can keep the lines nice and clear. If you have questions for Dr. Walker as you are hopping on in regards to our ASEA REDOX products, go ahead and put it over in the chat. We will be trying to address as many questions in the next 30 minutes as possible. But I do want to welcome you guys. I'm really excited to have Dr. Walker here on with us today. A little bit of background with Dr. Walker. He is double board certified in internal medicine and emergency medicine with a master's degree in preventive medicine, nutrition, and environmental health. So I'm really excited to have him on here with us today. And Dr. Walker, how long have you been using the ASEA products?
I've been using ASEA since October 8 years ago. So it'll be 8 years ago in a couple of months. And yeah, it's been a wonderful product to use personally and to see what it's doing for so many others.
Yeah, and tell us a little bit about what initially intrigued you about ASEA.
I was initially intrigued by the chemistry of it because I had seen references in my nutritional literature. You know, I was 64 when I discovered ASEA, but I had seen references to redox signaling as an important factor in ameliorating certain aspects of aging in my anti-aging nutritional literature. But I had no idea that there was a way to supplement with it because everything that I read said that it was a new technology. We were just discovering some of the aspects of it, and we probably wouldn't have a supplement product available for another 10, 15, 20 years because that's the usual development cycle. And I was very surprised to learn from a friend of mine who was a retired physical therapist that indeed there was a supplement and it was coming from a small company down in the Salt Lake area.
Amazing. Well, I'm excited to have you share with us a little bit. I've got a list of questions that that were posted, and so we're just going to run through as many questions as possible in the next 30 minutes. And I know that you answer a lot of these questions on a daily basis, so excited to have some of these answers for some people. So question number one is, I carry a genetic issue. Can you tell me what ASEA is doing on a genetic level?
Well, from an individual standpoint, the only way you're going to know in what practical way ASEA would benefit your health is to try it for 3 to 4 months. But the research that we have indicates, and this is only one aspect of the genetics, I think, where ASEA is involved, is that it opens up certain signaling pathways to make your cells, it's easier for your cells to access certain genetic programs that are in your DNA, because it's all well and good to have all of that information stored in your DNA, and there's an incredible amount of information coded in there to run your body at the cellular level, to orchestrate repair processes, all that stuff. It's amazing how much information is stored there. But if your cells can't access the information, it's a little bit like standing outside the Library of Congress and not being able to get in because you don't have a library card. So you can't do anything with that information. And what we know is that ASEA helps open up that door and allow your cells to access that information so it can use it.
Awesome. And then, so tell me, can ASEA help with problems with the nervous system? Something like jerking movements within the body, and just different issues that happen within the nervous system?
Sure. You know, we can't claim that we cure, heal, or prevent any particular problems, but ASEA works at the cellular level. And at the level that we're talking about, the foundation of cellular health and functionality, all of your cells work the same way, whether it's a nerve cell or a heart or a muscle cell or whatever. They all have the same challenges in one way or another, and they all respond in a common way to stress and trauma and disease. And so ASEA is just a tool that our cells use to help in the repair process and in functioning in a normal way.
Yeah, awesome. Well, and just as a reminder, I see a lot of people hopping on right now. If you have questions for Dr. Walker right now, as we're going through this list, feel free to put it over in the chat, and we're going to try to get through as many questions as possible. Of course, ASEA can't cure any disease, so please avoid disease names, but we are going to try to address as many questions as possible. So next question is, what does ASEA do on the cardiovascular level?
Sure. And for all of these issues, probably the best way to get a understanding for the variety of ways that ASEA can help is to go to like ASEA Healthy Self, and you'll find thousands of people's stories of what their problems were before ASEA and how their body responded once they started using redox signaling molecules. So it just so happens that in a study that we did to determine where ASEA was most effective at opening up certain signaling pathways, cardiovascular issues were one of the 5 areas where ASEA helped in the 20 to 31% range of facilitating that information flow, of making genes that control cardiovascular issues more available to our cells. And so, and this coincides with the fact that, practically speaking, a lot of us who have recommended ASEA for a number of years have seen kind of clusters of responses, and cardiovascular was certainly one of those areas. But it impacts all of our cells at this foundational level.
So here's a great question. Someone who is young, healthy, under the age of 20, what are the benefits that they might be able to receive from taking ASEA? Would you recommend them using ASEA, or we also have our ASEA Via line, our nutritional line. So if they're young, they're healthy, what are your recommendations for that?
Well, I would say that maybe the larger challenge for a really healthy 20-year-old might not necessarily be redox, because if he's healthy, his cells should be making a healthy amount of redox signaling molecules just naturally. But a lot of 20-year-olds don't have the best diet in the world. And so, having a really excellent source of concentrated micronutrients might give them more benefit over the long run. Because I know that, if you're eating a fast food meal, once every several days, you're just not getting enough of the real solid micronutrients that you need. And ASEA in the Via line has a great product called Source. It has several really good products that would be a good way to start with our line. But the other thing we do know is that the aging process actually starts much younger than we used to think. We used to think you didn't have to worry about aging until you turned 50 or 60. And we now know that the aging process actually kicks in. I don't know so much in your 20s, but it certainly starts kicking in by the time you're in your 30s, early 30s, because we have research to show that. And the research on aging shows that we actually have sort of an epidemic of premature aging going on in the developed world. And the cause of it is multiple. Lifestyle, diet, all kinds of things are contributing to that. So the sooner you start to slow down and help your body deal with the changes that occur as you age, the better. And you're just going to be really ahead of the curve if you do engage with redox as well as the Via line.
Awesome. That's great to know. This is a great question. I've been using ASEA for about 40 days and I feel absolutely nothing. Why is that?
Well, it may be that you have more damage and things that need to be repaired at the cellular level than you thought. And until a significant amount of repair is done, you're not going to notice that on the level of feeling different. But you can rest assured that as soon as you put these extra molecules into your body, if the body needs them, it's going to put them to work. And also, it just sometimes takes longer than you might think for you to feel the difference. I've had changes, 4 or 5 years into this that I didn't notice in the first, short period of time. So I would really also start to look for minor changes, minor improvements, more energy, not needing that afternoon cup of joe to stay awake, all those sorts of things that are sort of on the subtle side. But rest assured, you taking these extra molecules, you're making sure that your body has enough to do what it needs to do in terms of cell signaling and repair.
And what is usually the difference that you see in the range of when someone feels a difference within their body?
Well, a good tool to use is the thing that comes in each case of ASEA, the results tracker, and that's not put in there for just to waste paper. It's put in there so that you can actually sit down, spend 15 minutes rating certain aspects of your health and actually paying attention to how you feel in those different areas, and then redoing that every 2 to 4 weeks once you start the ASEA, because a lot of times people just don't realize what's going on until they actually start to think about it. But for a lot of people, it's energy. One of the first things I noticed was I was getting ready for ski season that year. And like I said, I'm 64 and a half years old. So I used to not worry about ski season. I'd just go skiing. But as I got older, I realized that I had to sort of prepare my body for the extra, stress of in those muscle areas. So I started, extra workouts and that sort of thing. And I was tired from that. But I started on the ASEA, and I would almost immediately started doing 2 workouts a day and felt fine. So what I had was extra energy. I can't say that otherwise I really felt different, but I noticed that I was able to do more and recover quicker.
Yeah, and we see that a lot in a lot of people right away, as usually that energy level. So I'm glad that you pointed that out. So we've got another question. Does ASEA help people? It looks like unhealthy life choices. So they've made some decisions that aren't really healthy. So can ASEA still help if you have unhealthy habits in your life? So whether it's related to your diet or other choices that you decide to make in life, will ASEA still help?
Well, yes, in one way. I mean, ASEA is going to help your body respond to inappropriate things that you do to it, negative inputs that you continue to do. Along those lines, I would like to say that not exercising is a negative input. Smoking, of course, and excessive alcohol, those sorts of things are negative inputs. But being a couch potato is a negative input. So if you're not exercising, you're contributing in a negative way to your health every day, for example. But ASEA does help your body to counteract some of the negative impacts of things. Smoking would be one of those. It's not going to necessarily make it any easier for you to stop smoking, but it will help at the cellular level to help your cells deal with the negative impacts of that bad habit, so to speak.
And will those people typically, they asked if that person will typically detox if they have those unhealthy habits and continue those unhealthy habits. Does it usually represent then and result in a detox then usually?
It depends on how you define detox. So yeah, it's going to help your body get rid of bad molecules that are not good for your cells. And that's an ongoing process anyway. So I guess the answer to that would be yes, it will help you to get rid of harmful things that might otherwise stick around and cause damage.
Yeah. And then what do you usually recommend if someone has a very serious chronic condition? How much ASEA should they be using?
That's a little bit, the factors that I like to factor in terms of dosage are, number one, age, because we do know that our cells make fewer molecules as we age in a rather predictable way because of wearing out of our mitochondria. So the older we are, we need more. And I've always thought that anybody that was over 50 or so would do better on 8 ounces than 4 ounces. The initial starting dose for everybody is 4 ounces. And my wife and I have both been taking 8 ounces from the very beginning because I took a look at it and realized kind of what was going on in the science of it, and realized that if 4 was okay, 8 was probably better. And so we've been taking 8 ounces. And I've also noticed that now if you're older and you also have accumulated some chronic health challenges, that many people based on my experience over the last 8 years, will do better with higher dosages. And so, 8, I would say, would be a baseline maintenance dose for somebody like that. It might take 16 ounces or sometimes even more before they start to really notice that difference. So what I do is I just have people, start with 4 ounces the first few days, bump it up to 8 ounces. And if they're patient, just take 8 ounces a day and see what your body does over the next couple of months. If you really want to push the issue and see if you can get a response quicker, then go up to 12 or 16 ounces. And then later, once your body has responded and using these molecules to do what it can do in terms of restoration, then you might want to try tapering back to an 8-ounce maintenance dose. And then if you see a recurrence, then go back up to the dose where you were getting the effects that you were looking for. But don't be in a big hurry. This isn't blocking or covering things up. What it's doing is allowing your body to do a better job at repairing. And sometimes that just takes a while. And sometimes we have to take more in the beginning, in the first several months, than we necessarily need later on.
Okay, that's great. So this next question actually has to do with the Renu 28. So how deep does Renu 28 penetrate? And maybe along those lines as well, what is so unique about Renu 28 as a topical gel?
Yeah, I don't know that we know how deep it penetrates. What we do know is it does penetrate, and we do know that it increases circulation by up to 50%. So I don't know if it's 2 millimeters, 3 millimeters, whatever, because once the molecules penetrate into the vascular layer of your skin where the blood vessels are, it's going to start moving around the body. So it's not going to just go deep and deeper, because it's going to spread around and into the body fluids. But it certainly gets absorbed very well. It certainly, we see what we call systemic effects just with the topical application. And that really, I really started to really understand that when we opened in Australia. And for the first year or so, the people didn't have access to the drink. All they could do was use a lot of Renu on a large part of their body and get more of these molecules absorbed that way. And they were seeing body-wide improvements similar to what people were getting with the drink, which really told us that these molecules were getting into their system and being spread around. What Renu has been shown to do topically is that it ameliorates wrinkling, it helps elasticity of your skin, it helps remove blemishes. I mean, we've got all kinds of before and after pictures available. And I guess overall, what you could say is it gives you a younger, healthier skin. So if you've got a bunch of, little wrinkles and that sort of thing that you've accumulated, barnacles, like some people call them, that as you use the Renu 28, that's going to improve. But, I will warn you that sometimes in the first, if your skin is in really bad shape, in the first month or so, you may not like what you see happening using Renu, because it's going to accelerate the cellular turnover, which means it's going to be busting out those old cells. New cells are going to be coming along behind it, and for a while you're not going to notice the improvement. So hang in there, stick with it, and Renu 28, especially on your face and arms and sun exposed areas, it's not just a product for us old people. My wife reminded me the other day that a lot of young adults are spending a lot of money on their skin and on their face and doing all kinds of cosmetic things, which many of those things would be accomplished by long-term use of Renu 28.
Awesome. And then what is the benefit of using both Renu 28 and ASEA simultaneously?
Well, what you're going to, the ASEA liquid is primarily for internal things, for the internal health of your body. It does certainly help the skin just by the fact that, it's carried there through the bloodstream and everything. But if you really want to concentrate on skin health, and if you've lived on this planet very long, and especially if you haven't been an avid user of sunscreen, you do have ultraviolet damage to your skin. And so, restoring the health of your skin back to as good as you can get it is a worthy goal. You know, a lot of people spend a lot of money and a lot of time at dermatology offices for skin-related issues. So it's an important aspect of your health that a lot of people tend to ignore, especially us guys. And it's not a good idea to ignore it. You need to take care of it.
Okay, so what can ASEA do for issues with inflammation?
But that's interesting. That's another interesting question because, and it gets back to the gene study that we did, because one of those 5 genetic pathways that were opened up where the signaling was facilitated was control of chronic inflammation. And inflammation, the acute aspects of inflammation are part of the healing process. If you get a wound or an infection in your skin or whatever, inflammation is your friend. It brings in white blood cells. It helps to repair that area. But when inflammation becomes chronic, as it does for all of us as we go through life, chronic, indolent inflammation is the leading cause of chronic and degenerative diseases. And whatever we can do to suppress that or eliminate it is going to be good in the long term. And that was one of the pathways that was influenced significantly by drinking 8 ounces of ASEA a day. So that's in the long run, that is perhaps the biggest benefit that people can get from taking ASEA long term is to help the body, your body's cells, to damp down that chronic inflammatory component, which is caused ultimately by oxidative stress. We don't need to get into the biochemistry of that unless somebody wants to, but oxidative stress, which is an excessive amount of reactive oxygen molecules causing damage at the cellular level, which results in chronic inflammation, which results in chronic disease. So anything we can do to control that is really beneficial in the long run.
Yeah, and can you briefly go through the rest of the things that were affected through that genetic study that we're seeing? Can you go talk about the rest of the topics? Yeah.
Yeah, I already mentioned the cardiovascular aspect, and when I see people, unless they already know they have a cardiovascular disease, and I ask them what's their biggest health worry, usually it's cancer. And cardiovascular disease kills far more people than cancer does. Cancer is a very nasty process, but cardiovascular disease is a much bigger problem. So cardiovascular disease, the fact that it benefits there is really a big deal. It also benefits our innate immune system, and that's the primary sort of first line of defense that our body has against a number of different things, infections and a few other things. And so being able to improve and fortify the innate aspects of our immune system is a big deal. We just talked about, controlling excessive inflammation. It also showed activity in the, digestive tract, gastrointestinal issues, and not specific ones, but just general aspects of digestive health, and then hormone modulation and hormone health. And as you all know, women tend to pay more attention to hormone issues than men. That's because they're smarter than we are, and we probably should pay attention. But being able to control and modulate and normalize, essentially what ASEA does is helps our body to normalize and create an environment of homeostasis, which is good. I'm not going to define homeostasis. Look it up on Google or whatever. But you want your body to be in a homeostatic situation, and you want your body to be normalizing hormones, because hormones are a big signaling process in our body as well. And redox signaling is involved in the hormone responses.
And then one other question that just came up, can ASEA help with, conditions that are related to difficulty breathing? So maybe more like lung conditions type of thing. What would you say to that?
Well, are there cells involved in lung issues? Sure there are. And so absolutely. And again, if you want to see what people are experiencing there, I would go to ASEA Healthy Self. There are so many testimonies about what people have achieved with respiratory issues. My wife's had wonderful response with that. I'm not going to mention the disease that she has, but it's something she's had for a long, long time that oftentimes caused her to be wheezing and short of breath and not able to do what she wanted to do. And the ASEA has really helped her in a major way. It's helped her body to deal with that so that she just very rarely has to do anything about that other than just to drink her ASEA.
Oh, and here's another question that just came up. Can it support older people who are suffering with memory loss issues related to aging?
Well, the answer to that is if you improve the health of your brain, and improving the health of your brain as we age has a lot to do with improving the circulatory aspects there. So again, we've seen a lot of people who have noticed improvements in that area. So it doesn't improve cognition directly. What it does is improve the health of your brain. And of course, where do your memories lie? Primarily, they lie in your brain. And so anything that can improve brain health and aging issues are usually, if you can improve the circulatory aspects of that and bring in more fresh blood, take away the waste products, because thinking does take energy and does, it's just like any other function of the body. It depends on having a healthy blood supply. And so, the answer to that is if you can improve the health of your brain and you can get your brain the tools that it needs to stay healthy, then memory is one of the things that you're going to probably notice is going to improve.
And then what can ASEA do for children who suffer from different conditions, even just within childhood?
I used to not really anticipate that ASEA was going to be all that beneficial for children, because when you're a child, your cells usually are making a sufficient quantity of redox signaling molecules. And then I started to recommend it selectively for certain children with issues who just weren't responding, or we just didn't have anything in regular medicine for them. And lo and behold, some of them had great results with the product. And I think what's going on there is that it's not so much that they have a deficit of production of redox signaling molecules. They're producing them, but their body can use more. So their body's using all that it can make, but does seem to benefit when we supply supplemental redox molecules that it can use for whatever purpose is necessary, for repairing, for functionality. A lot of people think that ASEA is just there for repair, but ASEA is there also. Redox signaling is there to assure that your cells are doing what they're supposed to be doing, because it's intimately involved in most of the biochemistry of what your cells are doing.
Awesome. Well, I think that we got through just about every one of those questions. Again, if you've got one final question, go ahead and put it over in the chat. But if you did ask a question, just remember a lot of people mentioned a specific disease name, and I avoided mentioning those. And so we just kind of relate it to the symptoms related to that. So hopefully that was helpful for everyone. Thank you, Dr. Walker, for hopping on with us today. We look forward to doing this again. We plan to do this on a more regular basis because we know there are many questions that arise when people are looking to try ASEA, and having experts like Dr. Walker is just incredible. So we appreciate your time. Thanks for hopping on with us, and we look forward to seeing you guys all again soon.
Great. Thanks, everybody.